Thank you for the introduction, Lou. So we'll just introduce ourselves to begin with. My name is Dr. Ian Heslop. I'm the Deputy Head and Director of Pharmacy Education here at the University of Lincoln School of Pharmacy.
And I'm Christy. I'm an Associate Professor in Pharmaceutics, which is basically how we make medicines. That's what I study.
Yeah, great. So just to introduce what we'll be talking about, we're hoping to talk about, first of all, what is pharmacy and how in the UK pharmacists are trained. We'll talk about career options as a pharmacist, and not that we're big noting ourselves, but myself and Christy will talk about, I guess, our careers to date, because we've both had, I guess, different careers, and in a way, the two of us combined shows some of the range of pharmacy careers that people, that pharmacists go into. So my background was, first of all, as a clinical pharmacist in the hospital service, both here in the UK and overseas, mainly in Australia. And then I drifted into lecturing. Christy, do you want to briefly talk about what you did, and then we'll go on?
Yeah, absolutely. So I did my pharmacy degree, and then I trained in hospitals. So you have to do a year's training after you've done your first degree. So I trained in hospital, and I worked for probably about 6 months as a clinical pharmacist. And then I went off and I did a PhD at the University of Sussex, because one of the great things about pharmacy is it gives you a really good science background. And I loved all the science I'd done on the pharmacy degree, so I thought I'd go and do a PhD. But one of the great things about doing pharmacy is that during that time frame of doing the PhD, as I was qualified as a pharmacist, I used to work in community pharmacy, and I still work in community pharmacy even now, all these 29 years later. And my career has been very much a sort of balance of the two sides of pharmacy, working in community, but also working as a scientist and a researcher. So I have a research group, and I've been doing research and producing papers, scientific papers, for again the last 30 years or so. So it's a really beautifully rounded career, which I've enjoyed very much so far.
That's great. So we'll talk more about our different career options, and I'll talk a little bit about the work I did here and overseas. And then I guess the university wouldn't forgive us if we didn't spruik the university a little bit while we're here. So we'll talk a little bit about pharmacy and pharmaceutical sciences here at the University of Lincoln, and why we think they're good programs, etc., etc. And then towards the end, we'll talk a little bit about the future of pharmacy, because certainly, I mean, even in our time, Christy, I think you would agree that pharmacy's changed such a lot since we trained, and it's continuing to change and develop. So we'll talk a little bit about some of the future roles of pharmacy, and where pharmacy's going, and how the pharmacy degree will change over the next sort of 5 to 10 years. So just to give you background. And then, of course, there'll be plenty of opportunity for you to ask questions at the end. So let's look first at what pharmacists do. What are pharmacists and what they do. And I think if you look at the sort of standard definitions of what a pharmacist is, most of the definitions will come up with something along the lines of that pharmacists are registered health professionals. So we have the same standing as doctors, nurses, physiotherapists, etc., etc. And the difference is that we specialize in what they call pharmaceutical care, which basically means that we are the medicine specialists in simple terms, and we deal with everything to do with medicines, from the initial development, research and production of medicines through to how medicines are delivered. And by delivered, we mean to things like hospitals, care homes, patients. And then we're also involved with the clinical use of medicines. And myself as a clinical pharmacist, my role was to advise prescribers and patients on how to use medicines, how they should be taken, how they should be managed and monitored. And increasingly now, of course, pharmacists are prescribers themselves, and it's one of the things we'll talk about, because the pharmacy degree is changing, so that in the next few years, all pharmacists on registration will become prescribers, whereas at the moment you have to do some further study. So how we become a pharmacist? Well, at the moment in the United Kingdom, to become a pharmacist, first of all, you must complete a 4-year Master of Pharmacy degree programme, and this must be completed in an accredited UK university like the University of Lincoln. Once you've completed your 4-year pharmacy degree, you then do a what's called a 12-month foundation year or foundation training program. And this is where the graduate pharmacist works in a hospital pharmacy, a community pharmacy, and there's various other options as well for a 12-month period. And during that time, they do some further study, they develop their clinical skills, and then they do various assessments at the end of the 12-month period and ultimately register with the UK's General Pharmaceutical Council, which we often call the GPHC. And really that is the start of the pharmacist career. And because we always look at the MPharm degree, when a student completes their MPharm degree, it's not really the end of their training, it's really the start of their career, because it's an entry-level qualification. And then the pharmacists move into different career strands, and we'll talk about some of the career strands that pharmacists work in, because there's a lot of options, and there's a lot of niche areas which suit different personalities. I don't know if you've got anything to add to that,
No,
Christine?
that's fantastic. I think you've
Yeah.
covered everything. Yeah.
Okay, great. So now, how do you get into an MPharm program to begin with? Well, there's various pharmacy schools throughout the UK, in all of the countries that form the UK, and the entry requirements vary a little bit from pharmacy school to pharmacy school. So if you're interested in doing pharmacy, it would be best to look at the website of the pharmacy school that you're interested in. But I guess the Lincoln School of Pharmacy is, I guess, what we would call a typical school of pharmacy. And so these are the current entry requirements into the Lincoln School of Pharmacy. So for entry into the MPharm degree, which is the 4-year degree, you currently need 128 UCAS points from 3 A levels. So that's equivalent to a grade, the grades of A, B, B at A level. Of course, nowadays you can enter university with a lot of other qualifications other than A level. So there's entries with BTEC and International Baccalaureate and that type of thing. But you know, the qualifications required in those types of qualifications, the grades required in those types of qualifications would be equivalent to 128 UCAS points. Now, the subjects that you need to study at A level vary a little bit from university to university. So at Lincoln, we don't, it's not compulsory that students have done chemistry A level, but they must have done biology or chemistry. And so we require students to have a minimum grade of grades B in either biology or chemistry, plus a minimum grade of B in a second science. And that can either be chemistry, biology, physics, applied science, maths, or further maths. The School of Pharmacy at Lincoln is also one of there's not many schools of pharmacy have this type of program, but we have what we call the MPharm with SPY, which is a science preparatory year. And this is to allow students who maybe haven't done the prerequisite science subjects at A level, or maybe got slightly lower UCAS points when they get their results, to do an additional year, science preparatory year. And in the science preparatory year, the students study chemistry, maths, they do academic skills, and there's also a pharmacy introductory subject. And this is to prepare them for entry into the normal 4-year MPharm degree. So this is an entry route that we have for students who maybe, like I say, maybe haven't studied science at A level, or maybe didn't get the grades that they needed for entry into the 4-year MPharm, and it's an additional year which just allows them entry into the degree, into the MPharm degree. Now, a lot of students think, oh, it's an additional year. and that's, you know, an extra year. It's going to take me even longer to become a pharmacist. What we're actually finding is that the additional year is actually beneficial, and the students who come through the science preparatory year often have a better understanding of chemistry and science when they come into the MPharm program proper, and they actually do better than some of the students who enter the normal 4-year degree. So it can be a benefit to take an extra year in your studies. So what we're going to talk about now is what you can do with a pharmacy degree. And I guess the obvious thing is, well, most pharmacy graduates become pharmacists, which is true. Most of our graduates do become pharmacists, and the majority of them work in areas such as community pharmacy, hospital pharmacy, and general practice. They're probably the main 3 employers of pharmacy graduates. The key thing to remember, though, is within each of those areas, so community pharmacy and hospital pharmacy in particular, there's lots of sort of niche or specialist clinical roles that pharmacists can specialize in. So, for example, I was a clinical pharmacist in hospital practice, and initially I worked in clinical pharmacy in general medicine and general surgical. And then for 3 years, I worked in a large psychiatric hospital and sort of did some specialization in mental health, and then did some work in drug information. So there's lots of different niche areas. I also did a little bit of work on aseptic manufacturing, and that's that side of things in the hospital. So yeah, there's lots of different niche areas that pharmacists can specialize into, and we often say to students that you know, when they go on placement, that sort of thing, look at the areas, look at your personality. What sort of areas would you like to work in the future? Like I said, you know, the community pharmacy hospital pharmacists are the main employees of pharmacists, but there is other areas where pharmacists can work. So we've had pharmacy graduates working for professional bodies like the Royal Pharmaceutical Society. We've had pharmacists working in not so much in hospital pharmacy management, but more the general NHS management of hospitals. Some pharmacists go and work for government bodies. Quite a few pharmacists go and work in the Defence Forces. So in the UK, the Royal Air Force and the British Army employ pharmacists. The Navy doesn't employ pharmacists, which is a historical thing, but the Army and Air Force do. And they also offer really good scholarships for pharmacy students as well. Like ourselves, some pharmacists come and work in the university sector, a lot work in pharmaceutical industry, a lot do further studies. So there's lots of different career options for pharmacists. But not just in pharmacy. What you've got to remember is, Christy has already mentioned this, the pharmacy degree is not just a degree which gives you entry into the pharmacy profession. It's also a general science degree, and it covers lots of different subject areas. And so some pharmacy graduates, when they finish their degree, don't actually go and work in pharmacy. They go and work in other non-pharmacy fields. So, for example, you know, the pharmacy training gives you a lot of experience in management and that sort of thing, and they go into management roles in other industries. We've had pharmacy graduates deciding that they want to become secondary teachers as chemistry teachers. We've had pharmacy graduates who then go and do a law degree and become like a medical legal specialist, and there's a lot of money could be made both suing and defending pharmacists and doctors and that sort of thing. But just to give you some example of the career opportunities that we have, first of all, Christy will talk a little bit about his career, and then I'll talk a little bit about my career, just to show you some of the opportunities that are open to pharmacy graduates and pharmacists. So I'll hand you over to you, Christy. Do you want me to do the Chris Whitty thing and for you to do Chris Whitty and say next slide, please? Yeah.
Next, please. fantastic. My route into pharmacy was a bit of a strange one, because I actually studied arts to begin with, and I did my A levels in arts subjects. So I did English and graphic design, and I did biology as well. So I had one sort of science in there, but it's a social biology. Then I went to art school and I studied photojournalism with graphic design, and I wanted to be a war correspondent, a war photographer, and ended up actually partaking in that type of environment. Was absolutely terrified. So I thought, I can't do this. So I then thought, well, I like animals, so I'll apply to veterinary school. And that time you could apply to both. There were the university and polytechnics, and I applied to vet schools in the universities, and in the polytechnics I applied for pharmacy. And the truth was, I didn't know what pharmacy was, and I missed out on getting into vet school. And I remember going to my pharmacy interview, and I was actually looking up the word pharmacy in a dictionary in the library 30 minutes before the actual interview. So fate takes you on interesting paths. So I got into pharmacy school, loved it. And one of the great things about it is the Royal Pharmaceutical Society, they gave me a scholarship in my second year to do research. So they paid me, and I worked on intestinal parasites, which was interesting, and actually synthesizing different types of drugs to treat those and test them to see how effective they were. And as soon as I sort of got an interest in doing research, that was it. My career for me was, in my mind, was set, and I'm still doing it today, 30 odd years later. So with the sort of pre-training before you get fully qualified, I trained in hospital, and that was really interesting because I could do many different areas. The way it worked at that time, we'd work in a dispensary for about 4 months, and we had a manufacturing plant within the hospital. And we made ampoules. So we made up injections that would go into glass ampoules. So I got involved in manufacturing those, and then working in a quality assurance lab, which was also in the hospital, quality control, to actually test and make sure those things were actually safe for use. Then I worked in psychiatry. I did general medicine, surgery, and drug information. So one of the things hospital pharmacy gives you is a very diverse view of different, very diverse range of subject areas, which is really interesting. Also, you see the most extremes in terms of medical treatment. After I finished my training, I worked in community pharmacy for a while because I'd always done that, and always enjoyed it. And I did a PhD, but I did something again which was quite unusual. I went and did my PhD in the School of Chemistry, and it was a really exciting time for me because amazing things were happening. This is at Sussex University, which is on the south coast of England. And if you look to the picture that we have on the left-hand side here, that gentleman standing at the end who has hair and doesn't have any fat is actually me. And now I don't have any hair and I am quite fat. So this is what the progression of all that time in pharmacy does to you. But what was so fantastic about this training is that the gentleman on the far right hand side is Professor Sir John Cornforth, and he had won the Nobel Prize in 1975 for stereochemistry of how enzymes actually work. And in the middle is Almaz, who's one of the postdocs in the lab, who's great. So I got this fantastic training, and it was a really vibrant time at Sussex University. So my second year of my PhD. If you look to the right-hand side, the gentleman who is second from the right-hand side is called Harry Kroto, and there's Curly and Small there as well. And they'd actually got the Nobel Prize for C60. So it completely energized me in terms of pursuing a career in research. But my own particular work at that time was in sort of phytochemistry. I was using microorganisms to change molecules to make medicines from them, and also to figure out how biochemical pathways were working. And what's fantastic now, all these years later, it's suddenly become really important again because we're looking at green chemistry. So now, I mean, the reactions that I do, they take away the need for chemicals and so forth. So everything I've learnt in this whole process has been incredibly useful, and everything's been applied that I've had from my training, which has been really fantastic. So next slide, please, Ian. Thank you. So I mean, the three sort of areas that I work in. So sort of, you know, in the top left-hand corner, this Sunday, I was doing a locum. So a locum covers for the pharmacist who's normally there during the week in the pharmacy. So I go and work in a clinical, in a community pharmacy, and there's all sorts of interesting things that happen, and you have a whole range of different situations. It's a very uncontrolled environment, so you never know who's coming in, what the situations are going to be. So it makes it very, very interesting and very exciting. And depending on what the day's like, I mean, you'll see people coming in with lots of, and they've been on holiday down to Skegness, and they've got lots of bites on them. Or one of the gentlemen, one individual presented, and he had all symptoms of esophageal cancer. So it's incredibly diverse what you're dealing with. And you're also sorting out medical problems and explaining how medicines work to people. Because if you think about it, at the end of the day, if you don't have pharmacy, if you don't have medicines which are produced there, you've got none of these things to take. Your doctor's got nothing to prescribe you. Hospitals can't work. You can't have operations. So all of that stuff behind in the research and the development of medicines and pharmacists working in all these different areas is absolutely paramount to the functioning of the whole health service. So I really enjoy it, even now, all these years later. Then on the right hand side, I have a laboratory at the university, and I have students who are doing PhDs and master's degrees. And one of the great things about my job is there's huge freedom in it. I can think of a science idea, and I can go to my laboratory and I can try things out. So it's really, really good fun and enjoyable. And the great thing about that is if you get involved in research, I've traveled all over the world with my job for free. And they give you lots and lots of nice food, and you meet lots and lots of interesting people in this big research community that there is. So that's a really enjoyable side. So all of that's going on, as well as writing papers and doing new science and all the rest of it. So it's a really exciting world. And that is my dog asking to go out of the door. So I shall ask Ian very, very kindly to change the next slide. I shall run over and let him out. Your timing is perfect, Roscoe. Go. There we go. So as I was saying to you, you know, you kind of never know why you get into these things and all the rest of it. But I started looking into the history of my family a little while ago, and it turns out that one of my ancestors, this guy on the right-hand side, who actually looks very much like my father, he's a guy called John Hunter, and he discovered the lymphatic system, which is something that controls water balance in our body, and it has lots of immune system functions. So the science in my family. He was also an expert on different types of diseases which humans can get, and ultimately that was his fate, because in those days he used to experiment on themselves to prove whether the science was right or wrong. Unfortunately, he died of a particularly nasty microorganism, but he had his place in science, and there are other scientists within my family, which is, I guess, some of you are genetically hardwired to do these things. Could I have the next slide, please? So for me, just to show you sort of the breadth, I mean, when you come to study a pharmacy degree, there's a lot of molecular science in it. So you learn about the organic chemistry, you find out how drugs will interact with receptors, and how that will bring about a biological effect. So you learn about pharmacology, drug action, you learn about microbiology, so you learn about the disease that's associated with microbes, but you also learn about how you stop microbes from spoiling medicines. There's an area called pharmaceutics, which is how we actually take the medicines, how we take the organic chemicals and we change them into medicines. So we make solutions and suspensions and tablets and injections and inhalers and all these sorts of things. So the subjects are really broad and really diverse, and it allows you to apply your knowledge in so many areas, which is so exciting. So you could be doing a ward round in a hospital, and you might be recommending what might be the best medication. So you may have had a patient who might be having difficulty swallowing. So very, very simply, can you get a medicine which you can get it in a liquid form, or can you crush it and safely give it in a form which is easy to swallow, and all those sorts of things. So it's just really being the drugs expert at the end of the day. So for me, the areas of research and what I'm interested in, these really sort of new medicines that are coming in, and they're on a tiny, tiny scale, on the nanoscale. They're so small, in fact, that they're equivalent to, if you took a little grain of sand, whatever your average grain of sand size is, and you cut it into 1 million vertical pieces, one of those pieces would be 1 nanometer. So these medicines are as small as that. They're absolutely tiny, but they allow us to actually get these to deliver drugs directly into tumors without affecting anywhere else in the body. So it reduces side effects. So it's really important for improvement in the delivery of medicine, particularly anti-cancer drugs, because they are designed to work on cancer cells will actually grow very, very incredibly quickly. And the way we use these drugs is to stop that rapid process, but it affects other cells. So these new sort of nano systems that we've got will go directly to the tumor sites specifically without affecting any other organs or organ systems within the body, which is really exciting. Gene therapy, single gene disorders, so things like cystic fibrosis, for example, will be one you might have heard of, or thalassemia, or hemophilia, those types of things. It's about designing medicines in which you can insert a new gene which will make up for the gene that those patients have actually got missing, and make them healthy that way. Raynaud's phenomenon is a bit of a funny one, but 1 in 4 people will get it. It's when their fingers kind of go yellow, in a cold environment or something like that. So there's a problem with blood flow. And there's other conditions like calcinosis, which is in there as well. But the key about all of this is I can do all of this because a pharmacy degree has such a broad range of science associated with it. So I can apply it in all of these areas. I understand molecular science, but I also understand what goes on in the human body. And that's why the pharmacy is such a powerful thing to actually do in terms of a subject. Okay, over to you, sir.
Okay, so I'll go through my career, and I guess like Christy, I've also had what some people would call quite a diverse career. I originally was brought up in the northeast of England. You can probably tell from my accent because I've not really lost my accent. Even though I've travelled quite widely, I've not really lost my accent. And then I studied pharmacy in the United Kingdom, and I went to the Leicester School of Pharmacy. It's funny how people choose which university they go to. I went to Leicester School of Pharmacy because at the time Leicester had the best rugby team in England, Leicester Tigers, and basically just went there because I thought, maybe I'll get to play for Leicester Tigers. Unfortunately, I never got to play for Leicester Tigers, but I got my pharmacy degree. And then I did my pre-registration training in Carlisle in Cumbria. Again, why I chose Carlisle in Cumbria was it was either Carlisle or Newcastle, and although Newcastle had some large hospitals, I chose Carlisle because it was close to the Lake District and I was interested in hill walking, and I still am interested in hill walking. But while I was working in Carlisle, because it was a smaller, medium-sized hospital, in my pre-registration training, I got to do a lot of things that I wouldn't have got to do at a large teaching hospital because there just wasn't the people to do all the different roles. So the roles were sometimes handed down to junior staff, whereas at the larger hospitals, those roles would be kept by the more senior staff. So it was good working in a small hospital. And then for a few years, I worked in hospitals, in various hospitals in the United Kingdom as a clinical pharmacist, mainly in South Shields in the north of England. I then went back to Carlisle, and for about 7 years, I then moved to Dumfries across the border in Scotland. So I used my pharmacy degree to get around a bit, but also to get experience in different specialties. So I initially did clinical pharmacy in general medical units and surgical units. And then when I moved to, I also did some work in psychogeriatrics, which is dealing with patients with dementia and Alzheimer's disease and those types of things. That then led to me moving across the border to Dumfries, and for 3 years I was the sole pharmacist in what was then a sort of 500-bedded psychiatric hospital in Dumfries, and that was really interesting as a clinical pharmacist because as a clinical pharmacist in the psychiatric sector in those days, you were fully involved in the psychiatric care team. So we worked closely with the psychiatrists, the nurses who were looking after the patients, and all the allied healthcare workers. And we had a key role in rehabilitating patients who'd literally been in a psychiatric hospital for 20+ years, and we were helping them to go back to live in the community. So it was a really interesting time to work in psychiatry, and gained a lot of experience in doing that. Then I moved over into drug information. So drug information is the unit within the hospital that if prescribers, they maybe suspect that a patient has an unusual, they've got an unusual disease or rash or illness associated with while they're in hospital, and they think that it could be drug related. The drug information pharmacist finds out if it could potentially be the drug which is causing the problem. We also give advice on how to safely use medicines, both to prescribers and so on. So I did a lot of sort of clinical pharmacy, specialising in various fields and getting a lot of experience in healthcare. And while I was at Dumfries, I also did a master's degree in clinical pharmacy with Queen's University in Belfast. So that was my second pharmacy school. Then in the early 90s, because I'd sort of got, by moving around, in those days, moving around from hospitals, you got promotion relatively quickly, but unfortunately then got to a level where the people in the grades above you were only a couple of years older than you, and were basically going to stay in those positions for quite some time. So I then took the opportunity to migrate. So for the last 25 years, I was a pharmacist in Australia, and I worked in the tropical part of Australia in North Queensland in a town called Townsville, which I was just saying to Lou, a lot of British people have never heard of Townsville, but it's actually Australia's biggest tropical city. It's a city of about 250,000 people, with a large military base, large hospital and university. And I initially went there to be clinical pharmacy and deputy director at the Townsville Hospital, which is the largest hospital north of Brisbane in Australia. And while I was there, because it was in the tropics, I got the opportunity to do specialist work on infectious diseases, because there's a lot of unusual tropical infections, and got involved with AMS, what we call AMS, which is antimicrobial stewardship. And this is a very important area because at the moment in healthcare, a lot of bacteria are becoming resistant to antibiotics that we use commonly, and also as well, we're not producing as many new antibiotics as we did in the past. So we've got to take care in how we use antibiotics and antimicrobials to make sure that we can continue using them for the next sort of 20, 30 years while we're designing new drugs, etc., etc. So I got really interested in infectious diseases and antimicrobial stewardship. While I was working at that hospital, and one of the reasons why I went to Australia was at the time there was massive shortages of pharmacists in Australia, and there was the hospital was basically operating on about 30% staffing levels because they just couldn't get pharmacists to work that far north because of the climate, etc., etc. So the local university, James Cook University, opened a pharmacy program and a medicine program to try and train health professionals for Northern Australia to correct some of the staffing issues that we had in Australia. And I started to get involved with the teaching of pharmacy students, and then eventually switched into academia. While I went into academia, similar to Christy really, I guess I also got an interest in research. And whereas Christy did a Doctor of Philosophy degree, I did what was what is called a Doctor of Public Health degree. So this is a different type of research degree. And because I was interested in infectious diseases, I specialised in travel health, and I did my research on the role of the pharmacist in travel health and advising travellers who are going overseas what medicines, vaccines, etc., they need to take prior to going overseas. And this then, because it was a Doctor of Public Health, led to me developing an interest in what we call pharmaceutical public health, which is where pharmacists don't just focus on the care of an individual patient, they focus on the care of a community or population. And I also furthered my interest in travel health and became a member of the International Society of Travel Medicine. And this society has a pharmacist group. And for about 10 years or so, I was on the leadership group of the International Society of Travel Medicine, which got me to visit parts of the world on conferences and that sort of thing. Whilst I was working in Australia, though, I got to do some work in Fiji because we had links with Fiji National University, and I did some work training pharmacists in Fiji. I also did some work training. The European Union funded a large health system strengthening program in Zambia, which is a country in southern Africa, and I was involved in a project where we trained the sort of top 14 pharmacists in Zambia about pharmaceutical public health. So I guess my pharmacy degree has allowed me to travel the world, specialize in various things, and also get a lot of experience of working with people from different countries, different communities, and so on. In 2020, I then decided to return to the UK to take up my current position as a deputy head here at the University of Lincoln. So that I guess is an example of where I've worked in a clinical environment, and we can, at the end we can answer any questions that you have. The last few slides we've got, we'll go through these slides quite quickly just to give you the opportunity to ask us questions. Like I said at the introduction, I think our university would be a bit upset if we didn't at least spruik the Lincoln Pharmacy Programme, because we think it's a very good pharmacy programme here at the University of Lincoln. And similar to the university I worked at in Australia, pharmacy was set up in Lincoln because there is and was a shortage of pharmacists in the East Midlands. So the idea is very similar to the university that I worked in Australia. The idea is if we train people from the Midlands to do pharmacy, they will more likely stay in the area, and it will rectify some of the health professional shortages that we have in the region. So I guess quickly, what are some of the benefits of the Lincoln School of Pharmacy? Well, we have a fully integrated 4-year MPharm degree, like I said, and we also have the option of doing the science preparatory year if students don't meet the entrance requirements for the standard 4-year MPharm degree. Our degree is very clinically oriented, but it has all of the key pharmaceutical sciences threaded through the curriculum, and we have a really good air placement program here. We're fully accredited with the General Pharmaceutical Council, and we recently went through a re-accreditation. And I guess at Lincoln, we're a relatively small school, and we have a lot of small group teaching, etc. We have what we call an integrated spiral curriculum. It's a fully integrated curriculum across the full degree structure. And what differs between Lincoln and the other some of the other pharmacy schools in the UK is that each of the year levels of our degree also has a focus on a specific part on the life cycle of the patient. So in year one of our program, we focus a lot on the early years, so infancy, childhood, etc. In year two of the program, we focus on the older child to early adult, the growing up phase. Year three, we can focus on patients like myself, middle-aged patients. And in year four, we focus on the twilight years, the elderly patient and some of the issues with end-of-life issues and so on. And throughout our curriculum, we've got various threads threaded through the curriculum. We study various disease states that are particular to those year levels, but we still have the sort of sciences threaded through. So sciences like pharmaceutical chemistry, pharmacology, microbiology, pharmaceutics is threaded across the curriculum as well. I don't know if you want to say anything about our program or curriculum,
Well,
Christy, before we move on.
I think one of the things I was going to say, and I don't know if we have a slide later on or not, but the actual university campus is fantastic.
Yeah, I forgot to put some slides in about the campus.
It is. I mean, please do come and visit. The university sits right. The university sits right in the city of Lincoln. So there's lots of student accommodation there. You can come in. You've got direct access to the city. It's a beautiful campus. It's a lovely environment to work in within a school of pharmacy. There's many other disciplines within there as well. So meet lots of different students there studying different things, and it's just a very nice place to be.
It's sort of like the best of both worlds, isn't it, Christy? That the university campus as well itself is very modern.
Yes.
However, the city centre, which is a 5-minute walk away from the campus, is very historic. So you've got that feel of a historical university town like Durham, Oxford, that type of thing. But you've also got a very modern, up-to-date, very modern, up-to-date facilities and campus. It's a really quite pleasant place to work, actually. So I'm quite happy with my decision to come and work here.
I mean, the other great thing, of course, is you actually get, when you graduate, once you've completed your undergraduate degree, you get the degree ceremony is actually in a cathedral, which is amazing. It's extraordinary, actually.
Yeah, it's pretty spectacular because in Australia, where I was working in Australia, you graduated on a basketball court. So there's a big difference between Lincoln Cathedral and a basketball court, but never mind. Anyway, so the last couple of slides we've got really just to talk a little bit about future directions of pharmacy. I guess the main direction of pharmacy, or the main change for pharmacy, is very much moving into what we call enhanced clinical roles. I mentioned the GPHC have come and visited Lincoln, and we're not allowed to say the outcome, but the outcome is very positive. The aim is that the GPHC is going to re-accredit all pharmacy schools in the UK in the next 3 years against some new standards. And these new standards mean that all of the pharmacy programs in the UK will have to change their curriculum so that graduates who graduate in the academic year 2025 to 26 will have full prescribing rights on registration. At the moment, for a pharmacist to prescribe drugs like a doctor, they've got to do their pharmacy degree, their foundation year, and then they've got to work for 2 years, do a further qualification, and then register as a prescriber. From 2026, all pharmacy graduates will be able to prescribe on the completion of their pharmacy degree and initial registration with the GPHC. So this is a really big change for pharmacy in the United Kingdom. And it would mean that if, say, you left school this year and joined a pharmacy program, you would come into the year that would allow you to prescribe on registration. Now that'll open up a lot of different clinical roles that we currently don't do in pharmacy. So if anything, pharmacy is very much a growing career. You know, it's a growing profession. The number of roles and options that pharmacists have open to them are huge. I guess other advantages of pharmacy as a career: relatively good salary, virtually 100% employment on graduation, and there's very, very flexible career options which suit the pharmacist, you know, in various periods of their lifestyle. So they're what some of the things that we think are advantages of pharmacy. I'm just looking at the time. I think it's time now for us to answer any questions that you may have.
Thank you very much indeed to both of you for that. I'm just going to ask students if they would like to type any questions into the chat function whilst we're kind of going through a couple of those that we had sent to us previously. But students, I would encourage you please to ask questions, type those in the chat function if you have any questions at all, because we have two very diverse experiences here, I think, from yourselves, Christine, in terms of both where you've studied, how you've studied, and how you've used that study in your careers. So Faye is also typing in. I think she's already put the link to the university on the chat function, and thank you, Faye, also to the campus and things as well. So students can go on there directly from here and look at those links. Can I just ask a couple of questions? One, perhaps if students are a bit reluctant to ask, but what kind of experience do you think that students, if they were looking now at applying for university, most of these are next year for 2023, between now and then, what can they best do to perhaps increase their experiences and their skills and opportunities really that they could take up in order to make a good application?
I think any experience in pharmacy or the hospital environments or a doctor's surgery, anything in the care environment is really, really important, because it'll give your students an idea of what the job is actually like. I mean, to be honest with you, for me, when I first went in, I had no idea what it was about, and I just sort of fell into it. But I think it's really important to get a good idea of what the subjects are actually about and what you can actually do. And if you speak to pharmacists, they'll give you an idea of sort of their paths they've taken in their careers, and they'll have a very, very good idea of what you would do throughout your degree and all the rest of it. And I think it would just reinforce, if you have an interest in the subject, it'll reinforce it more. And it's when you come to write your application, and you can actually say, well, I have worked in a pharmacy, or I've had experience in a GP surgery, I've worked in a hospital. All of those things are great. The way you go about it is just knock on doors and ask. Yeah, and I think that's the key thing. You've got to be quite resilient in it. But I think you know, put your head around one of the local pharmacies and say, can I come in for an hour on a Saturday or something like that, and just see what happens. And I'm sure they'll say yes. You know, so I think
that's really helpful.
Yeah, and I would agree with that. I would agree with Christy there. I think it's important to, I think it's important with any career to try and get some understanding of what that career entails, so because it helps you make the right decision. And like Christy said, I think there's an old saying in the northeast of England: shy Ben's getting out, which means if you don't ask, you don't get anything. So I think if you go and approach all sorts of health professionals, they're happy to, if you're really interested in their career, they're happy to give some of their time. They're happy for you to shadow them, and you may also get some part-time paid employment, which doesn't harm as well. So I think, yeah, it's useful to get whatever career you're looking at. I think it's useful to try and get some experience in that area.
Thank you, that's really helpful. I can see that Zoe has asked, is it worth travelling abroad to further study after the degree? I mean, you're probably a perfect example of that, Ian, but
I would say yes, because I guess that's what I did, and I think that really it's broadened my understanding of what pharmacy is, but also it's introduced me to sort of aspects of pharmacy care that I wouldn't have envisaged in the UK. So, you know, I've worked with Indigenous communities in the north of Australia and learnt about different, you know, cultural issues of working with Indigenous people and First Nations people. I've worked with, you know, Fijian people in Fiji, Zambians, and I think it's really I guess improved my knowledge, understanding of some of the different health situations in different countries. I think also as well, you learn a lot from working with different health professionals from different countries. They learn from you, you learn from them. I'm sure Christy would agree it's a sort of cross-pollination of ideas, and it's the same in research, isn't it?
Oh, 100%. I mean, so throughout my career, I've worked in America, for example. I've worked in New Orleans, doing research. I've got collaborators all over the world in doing research. So anything that allows you to travel, meet different people, it's just life enriching at the end of the day, and it's so life worthwhile for your profession, for your understanding about how people actually think, and actually getting to know yourself and what you can actually do and what's actually out there that you can grasp hold of and actually attain. So it's incredibly important, and if you have the opportunity, just do it, you know.
That's really helpful, and I can see Zoe was obviously very grateful for that response, and Faye's put up there some I think some real life stories from pharmacy experiences, and I think that's really helpful. Just a couple of other things I noted. I think, Christy, when you were speaking, I kind of wrote down a couple of words, and you used the words exciting and you used the word creative. And I think probably in the sciences, very often we forget that these can be very creative professions and very rewarding in a very different way from perhaps the ones that most of us would envisage on the opposite side of the kind of pharmacy counter, which is most of what we probably see of a pharmacist. But you've both talked about creativity, invention and development, and there's a very interesting, exciting opportunities, I think.
Creativity, I mean, it's funny because everybody thinks creativity is to do with the art side of things, but in science, in practice, there is massive creativity in all of these things. So yeah, I mean, for me, every day I'm thinking about creativity, doing something different, improving something, looking for a different angle on something. And the thing is, all of these things join together and it allows you to make a contribution. That contribution is to humanity, whether it's being a better practitioner as a pharmacist in treating patients, or doing better science, which might develop better medicines. You're actually contributing not only now, but to the actual future of people. And that's incredibly rewarding to be able to do that. And it's a real privilege as well. I mean, at the end of the day, if I was born 150 years ago, I would have been very rich to do science. So we're living in a wonderful time. We really are. And in terms of, if you look at the science side, the equipment that we have available now and all the computer technology and artificial intelligence, there's a real revolution going on at the moment. And it's a really exciting time to be in this area. It really is. I mean, I'm 56 in a couple of days' time, and I'm still bouncing around like a tigger, getting excited about things.
And that's very evident, and I think that's a tremendous sort of impression to give students who are kind of between the ages of 16 and 18, that excitement and interest doesn't go away, it actually just gets better. And I think
absolutely.
Most of us who are in rewarding careers, and I include myself, and I know my colleague Faye, very different careers, but I think that's where the variety and the excitement comes from, and that's absolutely wonderful. I can't see any more questions from students coming in. I think I've kind of covered most of the things. I wrote down, as I said, a few things, and I noted the Leicester Tigers, and as an Exeter Chiefs fan, I'm slightly perturbed about that. But apart from that, can I just say thank you so very much indeed to both of you for what's been an inspiring talk, one that we will take forward as well to, as I say, both the curriculum teaching staff and other students. And may we ask if we could perhaps, if there are any further questions after this, come back to you. And University of Lincoln have been a tremendous support for us. And so we would very much encourage students to go and visit the campus. I know the cathedral, I've been to the campus and only briefly to the campus, but I know the cathedral. It is an incredible city to be in, and I'm sure to be a student in as well. So thank you.
No, it's a pleasure. I mean, certainly your students would be welcome to visit anytime. We've got plenty of open days so please come and visit the campus. And you're right, I think our students are very happy here. So it's a nice nice university and a nice city to do 4 years of study in.
Definitely.
That's excellent. Well, King Edward's is actually, I don't know if you visited us at all in the past, but we are a campus very much like a miniature university here with 2,200 A-level students on it as a sixth form college. And so the step up to university, actually, I think Lincoln is a very good example of the kind of the next step. So I'd encourage all students to go and visit. Thank you very much indeed for this evening. We're all enthused about pharmacy now, and we look forward to seeing you again in the future, both. Thank you very much indeed.
Thank you. Thank you.
Bye.
Bye-bye. Bye.
Thank you.
Bye. Cheers. Bye-bye. Bye.